Beyond the task, the connection, Dr. James introduces the core idea that for oncology nurses, especially with pancreatic cancer, the job is a calling rooted in deep compassion. Their work blends medical expertise with profound human understanding. In the intricate and often heart-wrenching world of oncology, there exists a unique intersection of science and soul. This is particularly true for those who care for patients with pancreatic cancer, a diagnosis that carries with it a heavy weight of uncertainty and fear. For the nurses on these front lines, the role transcends a list of clinical duties. It becomes a vocation, a calling driven by a profound and unwavering sense of compassion. It is a space where the most advanced medical knowledge must be delivered with the most fundamental human empathy. Dr. James, a veteran oncologist, often speaks of these nurses not as mere assistants in the healing process, but as central pillars of the entire care ecosystem. Their work is a delicate, demanding dance, balancing the technical precision of administering complex treatments with the intuitive grace required to soothe a frightened spirit. They are not just treating a disease, they are caring for a person, a family, a life story that has been abruptly and cruelly interrupted. This foundational belief that true care extends far beyond the physical is what transforms their profession into a mission. It is a mission to provide comfort, preserve dignity, and forge a genuine human connection in the face of one of life's most daunting challenges. The compassionate assessment, showing how nurses use more than instruments. They use observation, touch, and deep listening to assess a patient's true state, not just physical pain, but anxiety, fear, and unspoken needs that a monitor can't show. In the sterile, data-driven environment of a hospital, it's easy to focus on the numbers on a screen: the blood pressure, the oxygen saturation, the pain score on a scale of 1 to 10. But for the oncology nurse, this is only the beginning of the assessment. Their most vital tools are not the machines that beep and whir, but their own senses, finely tuned to the subtle language of human suffering. A compassionate assessment begins with observation. It's noticing the slight tremor in a patient's hand as they reach for a glass of water, not just as a neurological symptom, but as a potential sign of overwhelming anxiety. It's seeing the way their eyes dart towards the door every time it opens, a silent plea for a familiar face or a word of reassurance. It's recognizing the forced smile that doesn't quite reach the eyes, a brave facade masking a night spent wrestling with fear. Then there is the power of touch. A gentle hand on a shoulder during a difficult conversation can convey more support than 1,000 words. It's a simple, instinctual act that breaks through the clinical barrier, affirming the patient's humanity and reminding them they are not alone. In these moments, the nurse is not just checking for a pulse, they are feeling for a connection, grounding the patient in a moment of shared presence. Perhaps most importantly, there is deep listening. This is not the passive hearing of a medical history, but the active, engaged act of understanding the story behind the symptoms. It's listening for the hesitation in a patient's voice when they say they refine. It's hearing the unasked questions lingering in the silence after a complex explanation of a new treatment protocol. It's creating a safe space where a patient can voice their deepest fears about pain, about dependency, about leaving their loved ones behind without judgment. This holistic form of assessment allows the nurse to understand the true state of their patient, a complex tapestry of physical discomfort, emotional turmoil, and spiritual distress that no monitor could ever capture. Dignity in the most difficult moments, highlighting how nurses preserve patient dignity during vulnerable procedures, symptom management, and end-of-life care. Their respect and gentle manner in these moments are a cornerstone of compassionate care. Pancreatic cancer and its treatments often strip away a person's sense of control, leaving them in a state of profound vulnerability. In this fragile space, the preservation of dignity is not a luxury, it is a clinical and moral imperative. Oncology nurses are the guardians of this dignity, acting with immense respect and gentleness in moments when patients feel most exposed. This commitment is evident during invasive procedures or in the management of distressing physical symptoms. When helping a patient who is too weak to bathe or use the restroom, a compassionate nurse moves with a quiet efficiency and a calm demeanor that normalizes the situation. They pull the curtain not just for privacy, but as a deliberate act of respect. They speak to the patient, explaining each step, ensuring they remain a participant in their own care rather than a passive object. They master the art of being present without being intrusive, of providing intimate care without sacrificing an ounce of the patient's personhood. As the disease progresses, symptom management becomes a primary focus. The nurse works tirelessly to control pain, nausea, and fatigue, not only to improve physical comfort, but to restore a semblance of normalcy and agency. They advocate fiercely for their patients, ensuring their reported symptoms are taken seriously and addressed promptly. This relentless pursuit of comfort is, in itself, an act of honoring the patient's right to live as well as possible, for as long as possible. The pinnacle of this compassionate duty is found in end-of-life care. Here, dignity is paramount. The nurse ensures the patient's final wishes are known and respected. They create a peaceful environment, managing symptoms so that final conversations can happen and goodbyes can be said. They might dim the lights, play a favorite piece of music, or simply hold a hand in the quiet final hours. In these sacred moments, the nurse's gentle manner and unwavering respect become a final, profound gift, ensuring that a person's life story concludes not with suffering and indignity, but with peace and love. Supporting the whole person and family, nurses provide holistic support, explaining complex information with patience, sitting with a patient in silence, guiding a family through a panic attack, or sharing a moment of humor, all acts of targeted compassion. The diagnosis of pancreatic cancer sends shockwaves not just through the patient, but through their entire family. The role of the oncology nurse inherently expands to encompass this wider circle of distress, providing holistic support that addresses the needs of the whole person and their loved ones. These acts of targeted compassion are as varied as the families themselves, tailored to the specific emotional landscape of each situation. A significant part of this support involves acting as a translator and guide. Medical jargon can be overwhelming and frightening. The nurse takes the time to break down complex information about prognoses, treatment options, and side effects into understandable terms. They do this with endless patience, repeating explanations as many times as needed, drawing diagrams, and answering every question, no matter how small it may seem. This empowers the patient and family, replacing the chaos of the unknown with the clarity of knowledge. Yet, sometimes the most powerful support is nonverbal. It's the nurse who pulls up a chair and simply sits with a patient in comfortable silence, offering a calming presence when words fail. It's the shared understanding that you don't have to be strong right now, that it's okay to just be. This quiet companionship can be a lifeline in a sea of emotional turmoil. The nurse is also a first responder for emotional crises. They are the ones who find a family member hyperventilating in the hallway and gently guide them through a panic attack, offering a glass of water and a steady voice. They are adept at de-escalating tense family discussions, acting as a neutral mediator who can recenter the conversation on the patient's needs. Amidst the gravity of the illness, these nurses also understand the therapeutic power of levity. They know when a shared joke or a light-hearted story about their own lives can momentarily lift the oppressive weight of the diagnosis. This is not about trivializing the situation, but about affirming life and humanity. It's a small, beautiful act of rebellion against the disease, a reminder that moments of joy can and should still exist. By supporting the entire unit, patient and family, the nurse reinforces the network of care, strengthening the very foundation the patient relies on. The emotional labor and resilience, acknowledging the immense emotional weight nurses carry and how they manage it, their ability to remain a steady, compassionate presence, shift after shift, is a testament to their remarkable resilience and dedication. The work of an oncology nurse is an exercise in profound emotional labor. Every day, they walk into a world saturated with fear, grief, and loss. They form deep bonds with patients and families, sharing in their hopes during a positive scan and absorbing their devastation when a treatment fails. They are the keepers of difficult secrets, the witnesses to final breaths, and the bearers of a constant, low-level, anticipatory grief. This emotional weight is immense and relentless. Unlike a physical burden that can be set down at the end of the day, the stories and faces of their patients are carried home, replaying in their minds during quiet moments. The cumulative effect of this exposure to trauma and suffering is significant, placing them at high risk for compassion fatigue and burnout. Yet, shift after shift, they return. Their ability to do so, to consistently offer a steady, compassionate presence in the face of such adversity, is a testament to their extraordinary resilience. This resilience is not an innate trait, but a skill that is actively cultivated. It is built through a combination of professional coping mechanisms and deep personal strength. Nurses learn to compartmentalize, to to create emotional boundaries that allow them to care deeply without becoming completely consumed. They find solace in their colleagues, forming a unique and powerful support system with others who truly understand the specific challenges of their work. In the break room, they share stories, offer advice, and provide a shoulder to cry on, decompressing the emotional pressure before it becomes unbearable. They also develop personal rituals to recharge and reconnect with themselves outside of the hospital walls. Whether through exercise, meditation, hobbies, or time spent in nature, they understand that to effectively care for others, they must first care for themselves. This dedication to showing up, fully present and emotionally available, day after day, is perhaps the most heroic aspect of their job. It is a quiet, unsung form of courage, a commitment to bearing witness to the hardest parts of life so that no patient or family has to face them alone. Their resilience is the engine that powers their compassion, a ripple effect of kindness, concluding that the compassion of a nurse does unjust help in the moment. It leaves a lasting imprint on the patient's and family's entire experience, becoming a source of comfort and strength they remember forever. The impact of a compassionate oncology nurse extends far beyond the walls of the hospital room and the immediate moments of care. Their kindness creates a ripple effect, a lasting imprint on the entire experience of the patient and their family. In the short term, an act of compassion can fundamentally alter the course of a difficult day. A patient's pain, anxiety, and fear may not disappear, but in the presence of a caring nurse, these burdens become more manageable. That single moment of connection can provide the strength needed to endure one more procedure, to face one more difficult conversation, or to simply get through the night. But the true power of this compassion is revealed over time. Years later, when families reflect on their journey with pancreatic cancer, their memories are often anchored by the nurses who cared for them. They may not recall the specific names of the chemotherapy drugs or the exact details of a surgical procedure, but they will remember the nurse who held their hand. They will remember the one who brought a warm blanket without being asked, the one who took the time to explain everything clearly, and the one who cried with them after receiving bad news. These memories of kindness become woven into the fabric of their story of loss. They do not erase the pain, but they exist alongside it, offering a counterbalance of warmth and humanity. The nurse's compassion becomes a source of comfort and strength that the family draws upon long after their loved one is gone. It reframes the narrative from one of pure suffering to one that also includes profound moments of love, dignity, and connection. In this way, the work of an oncology nurse is a legacy. Each act of kindness, no matter how small, is a seed planted in a family's most difficult season. It is a testament to the enduring power of human connection and a beautiful, lasting tribute to the life that was lived. The compassion of a nurse does not end when their shift does. It echoes forever.